Welcome, dear viewers, to the topic on dissolution. The topic is, what does a dissolution graph tell us? Whenever we perform the dissolution testing, mainly we perform the Q point dissolution and also we perform the dissolution profiling. There are different types of formulations like immediate release, then a delayed release, modified release, or control release, prolonged release. So depending on those formulation design, there are dissolution testing performed, and based on the different time points, we need to have a graph or plot a graph regarding the percent drug released or percent drug dissolved versus the time. So for IR formulations, generally we perform the dissolution testing for around 60 minutes or more than that for slowly dissolving formulations. And for prolonged release or sustained release, extended release, we perform dissolution testing from 8 hours to 24 hours. For delayed release type of formulations, whether these are the tablets or capsules, the dissolution profiling is done mainly in the acid stage and then in the buffer stage. So depending upon the results, we make the graphs. So what type of information you get from the dissolution graph, and how it will be helpful to you to understand the formulation behavior. So this video will be very helpful to you to understand what does a dissolution graph tell us. You should understand regarding the dissolution profiling. Dissolution profiling means we perform the dissolution test, we withdraw the samples at multiple time points and not at the single time point like in a Q point test. So a dissolution graph shows how the drug is released from the dosage form over the period of time, and the purpose of the test is to confirm that the medicine releases the drug in the way it was designed so that it is a safe and effective. So if you are having the immediate release type of formulation, the drug should get immediately dissolved. If it is delayed release, then it should have acid resistance and it should get released in the buffer stage. And if it is controlled release, sustained release, or prolonged release, it should maintain its profile in the early time points, in the middle time points, and at the later time points. So consider the immediate release formulation. It may be the capsule or it may be the tablet, it may be the salt gelatin capsule, it may be the suspension, or sometimes it may be the solution formulation. For some of the solutions also we need to perform the dissolution testing. Then immediate release tablets or capsules are designed to release the drug quickly. That's why the name is there, like immediate release. If the product releases at least 85% of the drug within 15 minutes, a single specification time is usually sufficient. Since most drugs are not absorbed in the stomach, uh, releasing the drug in 5 minutes or 12 minutes generally does not make the difference in the body. So if the formulation is very rapidly dissolving, or if it is rapidly dissolving with more than 85% drug release in 30 minutes, then single time point can be done. But in the research phase, in the tech transfer phase, and in the exhibit stage or site transfer stage, always the dissolution profiling is done. Also, dissolution profiling is done in the stability period. Delayed release products. So DR products, these are enteric coated formulations, or in a European region it is called as gastro resistant type of formulations. Delayed release enteric coated products may be tablets or maybe pellets, or these may be capsules, and these products should not release the drug in the stomach, and therefore dissolution testing is performed in two stages. So first stage is acid stage and second is the buffer stage. Acid stage, the product should not release the medicine or drug, and in buffer stage it should release. Acid stage, very little or no drug should be released. The limit is not more than 10% in the acid stage. Buffer stage, after changing the intestinal pH. The drug should be released rapidly. This confirms that the enteric coating protects the drug uh, from the acid, or the drug is not released in the stomach until the dosage form reaches the intestine. So it is regarding the delayed release formulation. Then coming to the modified release, the another form is extended release or control release, sustained release, prolonged release. These products release the drug slowly over the period of time. It may be the several hours, and they generally require at least three dissolution time points: early time point, middle time point, and the final time point. Early time point confirms that there is no dose dumping or less drug or higher drug amount is released in the early time point. Let's say 1 hour, 2 hour, or around 3 hours. And middle time points, it is around 6 to 8 hours or 10 hours depending upon the formulation design. Middle time point demonstrates controlled and steady drug release, and final time point confirms complete drug release by the end of the test. These time points ensure that the medicine provides a consistent drug release throughout the dosing period. Variability in the dissolution results. So you might be aware about the variability. The dissolution result should be consistent across the units. Dissolution results should also be consistent between the units. Those may be tablets, capsules, or other formulations. And as a general requirement from the various regulatory authorities, it is like for the early time points, the RSD percent RSD should not be more than 20%, and for later time points, the percent CV should not be more than 10%, or it should be below 20 for early time points, first time point, and later time point it should be below 10%. So, however, during the acid stage of the delayed release product at very early buffer stage points, the amount of drug release may be close to zero. So, in these cases, the CV may appear high because of the variability, but it should not be considered. The CV is not very meaningful at very low dissolution values. Instead, the focus should be confirming on that the actual drug release remains within the expected low level. Around it is not more than 10%. Then a dissolution graph is used to confirm that the formulation performs as the intended design, whether it is immediate release, that is rapid drug release, delayed release, that is no release in the acid phase of stomach, followed by release in the basic pH of the intestine, extended release or sustained release, a slow control release without a dose dumping. So the dissolution profile demonstrates the expected performance or required performance of the formulation to have a safe, effective, and formulation which meets the quality requirements. Now I will take you to the actual figures for the immediate release, delayed release, and extended release. For immediate release, you can see in the image the release of the drug is rapid, and it is rapidly immediately available for the absorption. So tablet formulation like disintegrates and release the drug. So tablet may be containing the soluble or low soluble type of drugs. Depending upon that, you need to do the profiling. So percent drug released or percent drug dissolved versus time in minutes is plotted, and the specification it is like 80Q in 15 minutes or 30 minutes or 45 minutes. Sometime it is around 60 minutes. So in the research phase, the dissolution profiling is required to be performed. If you are working on the generic formulations, you need to perform dissolution test in multimedia like 0.1 normal HCl, then pH 4.5 acid buffer and pH 6.8 phosphate buffer along with the reference formulation, and you need to meet the similarity requirements. So the immediate release graph or immediate release dissolution profile graph shows you or tells you that the drug is released quickly in how much time, more than 80% or 85% drug is getting released or dissolved, and complete release before the gastric emptying, which is generally around 15 minutes, and ensures consistent and reliable immediate release performance. Now coming to the second type of formulation, that is delayed release. It is called as enteric coated or gastro-resistant or simply DR formulation. These may be tablets or capsules. Pellets are also there. So, is the drug protected in the stomach and released in the intestine? So, purpose is to protect the drug uh, or the stomach. So, sometimes stomach irritation may be there because of the molecules like aspirin. Sometimes the drug may get degraded, like different prazoles are there, omeprazole, esomeprazole are there in acid and release in the intestine. So acidic pH, and then it pass to the basic pH of intestine. There it should release the drug for absorption. So percent drug release versus time in minutes. It is for 2 hours in the acid stage, and after 120 minutes it will be in the buffer phase. So in the buffer phase it will be around 60 minutes, or sometimes it will be around 120 minutes. So acid stage it is 0.2 normal HCl, buffer stage it is a 6.8 pH phosphate buffer generally. So what it tells you? It is showing you, or it is telling you that little or no drug release in the stomach. Enteric coating protects the drug, and drug is released after reaching to the intestine. Now coming to the extended release ER, MR formulations, SR formulations. Is the drug released slowly and consistently without dose dumping? So there should not be any dose dumping. That means more amount of the drug should not be getting released. The purpose of the extended release or modified release or sustained release testing is that to test whether the formulation release the drug in the predefined way or with the predefined required concentrations. Purpose is that release the drug slowly and steadily over several hours. Matrix controls drug release may be there, and slow control release may be there. So different type of formulations are available in the form of tablets or capsules. Dissolution profile will tell you the information about the early time point dissolution, and it should prevent the dose dumping. Middle time point shows controlled steady release, and the final time point confirms complete release of the drug, and it is generally not more than, or it is not less, it can be not less than 80%. Early time point may be around 20 to 40%, then middle it might be 40 to 70% or 60%, and the final time point not less than 80%. The extended release graph, dissolution graph tells you that no rapid initial release is there, no dose dumping is there, and the dissolution is controlled, steady release over time, and complete release by the end of the test. So, whenever you are performing dissolution, you should know your formulation, and based on that, you can do the uh, interpretation from the graph. So once again, this slide I have made for your easy understanding regarding the dissolution profile for immediate release, delayed release, and the extended release type of formulations. So if you perform dissolution, always have a graph so that it will give you easy understanding about the drug release behavior and the behavior of the formulation. Also on stability, you perform the dissolution profiling, and it will tell you the information that whether there is a change in the dissolution from the initial or not. So this is the information and learning from the dissolution graphs. If you have any questions or suggestions, please do comments. I will be happy to see your comments and answer your queries if you have any. Also, if you have any problem in your products in the understanding for the dissolution, so you can mail me or you can message me. I will try to answer your questions. Thank you for watching the video.